Today on the Surviving the Human Experience podcast, I am excited to welcome Dr. Emily Cabrera to the show. Dr. Emily is a psychiatric mental health nurse practitioner and the co-founder of Dual Minds Integrative Psychiatry. She provides holistic and trauma-informed mental health care that supports the whole person in mind, body, and spirit. Her practice is centered on creating a safe and compassionate space where people feel understood and empowered to heal. With nearly 20 years of experience in critical care nursing as well as nursing education, Dr. Cabrera understands the emotional challenges faced by clients, healthcare workers, and caregivers. She works with individuals of all ages, including those experiencing perinatal mood and anxiety disorders, burnout, trauma, depression, anxiety, and major life transitions. Her approach is shaped by both her professional background and her personal experiences, including cancer and postpartum depression. These experiences strengthened her empathy and deepened her commitment to helping others build resilience and find balance. Dr. Cabrera provides psychiatric care with a focus on supporting nurses, caregivers, and anyone navigating high stress environments or significant challenges and changes. She is dedicated to helping each person feel seen, supported, and capable of healing. So, welcome to the show, Dr. Emily.
Thank you so much. That is so weird to hear it read out loud.
That's you. We're talking
It,
about you.
oh, it feels like imposter syndrome.
Oh my gosh, I know. Every time it's like, wait, people say stuff, you're like, wait a minute, is that me? Have I done all of these things? You sure have. And we are
Yes.
excited to uncover and discover with you this evening, and just to learn a little bit more about who you are and how you got, where you are, what your story looks like, and how it unfolded. So you've been on an incredible journey just from what we've read here and we talked about. So can you just share a little bit more with our listeners so they can become a little more acquainted with you?
Sure. So, like you said, I'm Dr. Emily Cabrera, but I am a nurse at heart. I just have my doctorate in education. So the second you get that doctorate, you can add it on, right? And
Absolutely.
when I'm teaching, it's Dr. Cabrera with all my students. But I am a psychiatric mental health nurse practitioner. And really just am trying to navigate that next round of my professional career.
Hmm.
That's the nice thing about nursing, honestly, is
Yeah.
that I've just been able to focus on so many different avenues that gave me skills to kind of culminate to where I am now. So you don't
Mm.
get bored in nursing. So just shout out to all the nurses out there, or if you
I
want to be a
love
nurse.
it. Yes, and so many hours and so much time and dedication goes into your profession. I mean, it truly is a labor of love when you choose nursing. It really
Yep.
is.
We're
Yeah.
the number
Oh,
one trusted profession for a reason, girlfriend.
yes, I
I
totally
know.
agree and understand. Absolutely. I agree. All right, so let's talk about your transition. As you transitioned from the career in critical care nursing, you shifted into psychiatry. Very courageous and bold move, might I add. So tell us, when did you realize that you were going to be making this bedside to brain shift? Because we're here today to talk about from bedside to brain and nurses transition into psychiatry. So tell us how that happened.
In the ICU, we would see the best of the worst.
Okay.
That is a good way of putting it. You literally see people at their worst, and that could mean that they're intubated and sedated and they're one step away from dying.
Okay.
But it could also mean that they are able to talk to you. They're just kind of in that crisis, and it's a full blown crisis where they need the extra help. So I would always get the clients that just had some kind of mental health something to it because I connected well with people and I'm
Hmm.
a very empathetic, meaning I'm able to relate to people
Hmm.
um, in a way that makes them feel comfortable. So if the person was withdrawing from alcohol,
Hmm.
down the hallway was screaming at the top of their lungs. They'd be like, Emily, where's Emily? She'll talk him away from the ledge.
Oh,
And I'm like, oh, okay, well, that's good. But I also have my other stuff I need to do. But
right.
okay, if you
You're like,
want
I
to
have this other
switch.
caseload here tonight,
Yeah,
but all right.
yeah.
Mm-hmm.
So I just kind of was drawn to it. And then I would always in the ICU get the people who were dying. And let me tell, like, you know, hospice nurses are very special. In the
Mm-hmm.
hospital, it's a little different setting when people are passing away. But let me tell you, the crazy comes out when somebody is dying. People
Mm.
start arguing about finances, there's guardianship issues. I've had people tell me, "Oh, keep my one loved one alive because, I live in their apartment and I have nowhere else to live." Like
Oh, wow.
it is just the reality of where people are in
Mm-hmm.
their life's experience, right?
Wow.
So, that kind of drew me to mental health also because I was able to come in and be like, okay, let's calm the storm. Let's
Mm-hmm.
focus on your loved one. And it takes a special person to do that, especially in the ICU. And then
Mm-hmm.
at the same time, I was teaching. So I always had two jobs going at the same time.
Okay.
And students can also act crazy. Yep. Um,
Well, there's that.
and yep. And COVID changed everything.
Mm.
Literally. So, I was in the ICU the beginning of COVID, like right around when it first started. My girls were little. I was also teaching at the same time, and I had students at midnight emailing me saying they're so stressed out. This is the first wave of COVID. They're so stressed out that they feel like they want to kill themselves. It was horrible. Frontline workers, it was
Wow.
horrible. Teaching, in academia, college was just as crazy because people had a hard time coping. They were so worried, right? Like,
Mm-hmm.
and you feel like a complete sense of a loss of control. Um,
Right.
so as I was, you know, going through that, I left the bedside. I said, screw
Mm-hmm.
this, I can't do this.
Mm-hmm.
And then I really went headfirst into teaching.
Mm.
And it just kind of kept on coming back to me. Like, I need to continue on with my own studies and I need to find ways to help these populations that just keep being pulled towards me, or I'm being pulled towards them rather.
Mm-hmm. Mm-hmm.
So fast forward a couple of years later, I still teach, but now I'm focusing on my mental health, uh, clinical focus as a psychiatric mental health nurse practitioner. So that was a
Wow.
very long way of saying
No, that
my
was
my
beautiful.
professional career.
Yeah, no, that was beautiful. And it sounds like there were so many whys. It wasn't just one why that pulled you in that direction. Like you saw so many different things and wanted to be part of the solution and
Yes.
making things
Yeah.
better. Yeah,
Yep.
making the patient experience better, just shifting the mindset of how things are handled. And I love that you shared that you also are in the teaching capacity because you're not only just going out and starting this new transition and adventure for yourself, but you're able to pour into others and help that industry, which is so huge. I love it. Mm,
Well, that's a
good
good
stuff.
thing too. Yeah, about nursing is that there's so many entry points. I just kept on going on in school. So 7 degrees later, this is where I'm at. I found something that I was good at. I like
Hmm.
to keep my student loans in forbearance. Just kept on going to school. No, but I was really
I love
good
that.
at it. Yeah, and I like the learning. But in nursing particularly, there are lots of students that really need that support and they
Hmm.
just don't have a lot of confidence, and maybe they were nursing assistants or this might be their first degree and they needed the help, and that's all mental health.
Hmm.
Like
It
if you
is.
don't believe in yourself and have the confidence, well, there's a reason for that, and that's a coping mechanism.
Right.
So they're all related to each other.
Mm. I love that you pointed out that it's all mental health. There's so many stigmas around mental health, and people automatically assume if they hear the term mental health, there's got to be illness involved. There's got to be this, big, huge story that goes with everything. We all have mental health. It's all part of our
Mhm.
psyche, it's all part of our makeup, and, it's something that needs to be kept in balance, just like everything else, just like we do with our emotions, just like we do with our physical health, our spiritual health. It's all part of what makes us human.
That's
Yeah.
where part of Yeah, that's where part of my business name came
Hmm.
from.
Okay.
So, yeah, so I am a founder, co-owner. My One of my friends, Jamie, we worked in the CCU together, the critical care
Okay.
unit together. We got our doctorates together. We got our
Mm,
master's degree.
mm,
Like she's going back to school to be a nurse practitioner also. So we've
okay.
just done a lot of professional stuff together. But we
Mm-hmm.
were working a shift and we're going, Jamie, like these are our long-term goals. This is what we're going to do.
Yeah.
So we started talking about the different perspectives of mental health. And there
Mm,
is in Western medicine, especially, we're talking the United States because that's where I live, and
right.
you could say a lot about what Western medicine does
Yeah.
well and what it doesn't. But in Western medicine, especially psychiatry, they believe that there is the healthy brain and then the sick brain.
Mm-hmm.
And in the sick brain, that's where your mental illness happens,
Mm-hmm.
which we know is not the truth. There is no quote unquote normal, there is no healthy brain. Like that's just crazy.
Mm-hmm.
It, you're always going to be disappointed
Mm-hmm.
if you feel like you're not this perfect version of a person.
Right.
So dual minds,
Mm-hmm.
integrative psychiatry, there is the healthy brain, there is the not healthy brain. Well, integrative approaches are much more naturopathic,
Mm-hmm.
um, and and we really believe in just supporting where the person is.
Mm,
You know,
I love that.
sometimes living with dysfunction, um, whether it's dysfunctional coping mechanisms, it might be a neurotransmitter imbalance, it might be their life experiences that are preventing them from moving forward. This could be a life coaching issue.
Mm-hmm.
This could be their, like what you do, their energy. Maybe
Mm-hmm.
they need help besides a pill.
Right.
But
Yeah.
the goal is to get them to optimal health. And that might
Mm-hmm.
be living with their mental health imbalance. Like that's okay
Mm-hmm.
too, you know?
Absolutely. I mean, honestly, what defines normal anymore?
Nothing.
There really
Nothing.
isn't a normal. I mean, it really is a world where we're all unique and we're all different and we're created a certain way for a reason. And we just have to work with what we have and learn ways to, as you mentioned, just the duality of everything, right? Living with
Mhm.
who we are and how we are and creating ways to exist and enjoy our human experience along the way, because that's the goal.
Yep. I was watching a TikTok thing, like it just randomly, popped up, because now being really focused on trying to better understand where people are coming from, you can get a lot of life experiences and people's stories off of Instagram and Facebook
Yes.
and TikTok. Like you can really hear people's perspectives off of that.
Hmm.
Um, and one expert was talking about, well, first off, there are no experts
Hmm.
ever, but one person who believed he was an expert, but had a really good message. And he was talking about the people who look most perfect are actually the most messed up, and they're putting on a front for a
Hmm.
reason. That's a
Hmm.
coping mechanism, right?
Hmm.
So pay no attention. Just
Yeah.
stay in your lane. And
Yes.
if you're happy and you're weird and you're doing your own thing and you are happy and you're not
Embrace it.
hurting yourself or others, what's wrong with that?
Agreed. And it's an interesting point you brought up about social media. I've done a few episodes on, just the impact of social media and its way of intertwining with our lives. And it is fascinating because people are, you get bold when you're behind that cyber experience and you got the
Yep.
keyboard, right? And people are more willing to share their story than if they're in an
Yes.
intimate setting, especially as we drill down through the generations. We have a whole generation of children who went through COVID who learned about learning in the bedroom, right? At their desks
Mhm.
in their rooms or from their kitchen tables, where they have almost associated their form of communication through texting and social media
Yes.
platforms. They don't even communicate in full sentences. I mean, I can remember sitting down with my kids doing some papers and I'm like, what is that?
That's gone.
We're not we're not
Yep.
texting. A paragraph has to have 4 to 6 sentences, and
Yeah.
the version of me starts coming out, from when I was in school, and I'm laughing because again, it's so different, and understanding how people communicate is so key. So just as you were sharing, looking at these videos, these kids on Instagram, TikTok, they're pouring their hearts and souls out through those stories and saying things they wouldn't say to their friends sitting next to them.
Yeah,
So
and
that's
then you stick them in a
interesting.
room. Yeah, then you stick them in a room with a bunch of kids and or people, peers their same age, and they have no idea how to
Yes.
be socially
Yes.
navigating those experiences.
Hmm.
It truly, COVID truly changed the entire dynamics of our social system, if that makes
Agreed.
sense.
It
Yeah.
absolutely does. It absolutely does. And now we're in such a cancel culture that
Yeah.
I think a lot of people are almost fearful to express anything because if they say something wrong or if their ideas don't seem popular at the time, then there's such judgment that's cast. And it's much easier, I think, nowadays to do that because of the internet and because of the
Yep.
social media. It can move so fast. I can remember my kids coming home and there would be like a fight in school. Somebody would be filming this fight and they would just airdrop it to everybody in the
I
school and they
know.
could see it. And so I look at stuff like that and I'm like, gosh, it's so hard to even be human at this point
Mhm.
because there's so many angles of judging and just you're always I had a boss once and this was such a profound thing he said because fast forward now 20 years later and I'm like wow he made sense now. He used to tell us the camera's always on and I used to be like what is he talking about? I was a little intern at the time and I'm like okay, so just be on your best behavior, is that what you're saying? But now fast forward, the camera is always on, either somebody's ring camera, somebody's phone
Literally.
camera,
Yep.
a
Yep.
policeman's camera, there's always a camera on you. And it's become so invasive, I think, that it has really impacted the way people are able to function in society.
Well, in mental health, so some of my clients are kids, like
Mhm.
ADHD and maybe conduct disorders, and um, so it's so crazy because like when we were growing up, I'm 46.
Mhm.
We
Yep.
didn't have any of that. We didn't have a cell phone. I didn't have a cell phone until I was in college. Like,
Yeah.
so when something happens, just human nature, you move on. People
Mhm.
move on. But like you have these little kids, these 6, 7, 8 year olds,
Mhm.
um, whose parents are recording them as they're throwing a fit. Okay. Like
Yeah.
there's a whole dynamic behind that. But the parents are
Mhm.
like recording them because then they want to take them and show the video to their psychiatrist or the teacher to prove the point that the kid is misbehaving, right?
Mhm.
Like quote
Mhm.
unquote misbehaving.
Right.
But then what the parents will do is re-look at that video 900 times so that way we can never move forward. And the poor kid is being chastised over and over and over again.
Yeah.
They're 7 years old. They're gonna make mistakes and their
Mm.
brain is developing. And like you're not
Yes.
teaching them good resilience by constantly throwing it in their face how they behaved 6 months ago. Move on.
And
Like,
not to mention the whole theory behind if you continue to relive an experience,
yes,
your subconscious and your
yes, you're
conscious do not know the
re-traumatizing
difference.
them. Yes.
Yes, it does
Yes.
not know the difference whether that's happening now or in the past.
Mhm.
So you're
Mhm.
reactivating that same nervous system response. So
Yes.
the parents getting all
Mhm.
fired up again because they're like,
Yep.
look at this little
Yep.
child of mine. I'll use my good
Yes.
words. And then the
Yep.
child is like, oh my gosh, like I can't live this
Mhm.
down. And it's this constant feedback loop
Yes.
that continues
Yep.
to persist. It's the hamster wheel where no one's making progress going forward. And now you've created a fight or flight response in that body. And so that
Mhm.
person can't settle down and the parent can't settle down. So, um, yeah, whew, we just totally
Well,
digressed.
friend,
But that was a good conversation.
I'm telling you, welcome to mental health.
I was going to say we can have lots of conversations. We're going to be doing many episodes, I see. We might get to our topics and a few of them, who knows? We might
That's
discover some
okay.
new ones along the way as well.
I know,
So,
right?
okay, so going back to the whole transition though, I do want to know, Cole, as you were shifting over from, just moving from that space of being a nurse to going
Mhm.
into the psychiatric space, what was that big, challenge you experienced?
I think it's having confidence in myself. The
Mm,
the biggest uh thing that I've had to learn for myself
mhm,
is really standing in my ownness
mm,
and taking this leap, especially into my own business. I'm the sole provider of my family. I have bills I have to pay. My husband lost his job during COVID. I
Mhm.
am the sole provider. So
Mhm.
to have faith that I am smart enough, I'm capable enough, the stars will align, it
Mm.
will be okay. As long
Yeah.
as I'm smart and make
Right.
good, sound judgment,
Mhm.
it will be okay. I just have to trust the process.
Mhm.
Um, when I really start to freak out, maybe about money or bills, like that's the life we live in. I have bills I have to pay. Everybody is in the same boat, right?
Yes.
Um, every time I freak out, I have to re um almost like retell myself, Emily, it'll be okay. And it always
Mhm.
is okay. It
Yeah.
always works itself out. So where one door closes, another one opens. So I've been trying to work on that is just allowing what will be, and
Mhm.
the stars will align. And it
Yeah.
has worked out, like we're talking to each other. A
Right.
month and a half ago, I would have totally freaked out and like, oh my gosh, what's going on? But
Yeah.
I trust the process. And
Yes.
now I feel like I'm really coming into my ownness,
Yeah.
with
I
this next
love
round.
it. So
Mhm.
having that faith, knowing that things are going to work out the way they're supposed to.
Mhm. Mhm.
And we get in our own way oftentimes, and I do it myself, so I'm not telling you anything
Mhm.
that I'm not guilty of
Yep.
here. Pushing things because we believe it should happen a certain way, or it's not happening fast enough, or
Yep.
maybe if I just do this, this will be the better outcome. And that usually gets us in trouble. But
Yep.
if we trust the process, like you said, we go through the experience and it happens when it's supposed to, it will happen the way it's supposed to happen versus the way we force it to happen and then we're cleaning up a mess.
It's really listening to your gut,
Mm,
truly, because your gut, it's like that feeling deep in your soul. And we just say your gut because we have to put a
hmm.
location on
We
it.
have to put it
But it's,
somewhere.
yeah, but it's your brain kicking in, and it's that really early precursor of the fight or flight. Like
Yeah.
your limbic system, your amygdala, your hippocampus, like it's telling you something feels off. So if
Hmm.
you listen to that and you're really in tuned with it, you
Yeah.
know, you will make the right decision
Hmm. For you, the right
for
decision for
for
you.
yourself
And
and your
that's so
family and
important.
whoever.
Yes.
Yes.
Yes, it's so important to point out because I think people get caught up in what's the right decision, what's the wrong decision. Oh, I should have done this. And it's what's the right decision for you, not for your friend, not for the person next
Hmm.
door, not for your mother, uncle, cousin, aunt, whomever, for you. Yeah,
Yep.
good stuff. All right, so let's jump into Dual Minds Integrative Psychiatry because I want to talk about it. So you're the co-founder. You shared a little bit already with us. Um, but I want you to just kind of share more about Dual Minds Integrative Psychiatry. What makes it so unique and what are you doing that's so different that you can share with our listeners?
The longer I got into psychiatry, the more I realized, especially the Western model, which includes insurance. There is a
Mm-hmm.
time and place for insurance. Listen, I had thyroid cancer. I could never have afforded the care that I needed in Boston for my
Mm-hmm.
surgery and subsequent endocrine consults and so on and so forth. I had to have my insurance at that time. The longer I've been in this nurse practitioner role in
Mm-hmm.
psychiatry, the more I realize how dysfunctional it is.
Mm-hmm.
So, insurance here is a
Mm-hmm.
Western model approach.
Mm-hmm.
So I would have these, appointments with clients, and it'd be 15 minutes, a half an hour. And, you can't even go beyond asking them, how are you feeling?
Right.
Have you been, you know, having thoughts of hurting yourself or others? And you just want to make sure you're safe so that way when they leave, if they do hurt themselves or others, you know that you kind of dotted your I's and
Covered your
crossed your T's.
bases. Yeah.
It was so dysfunctional. So when I made the decision with my friend Jamie,
Mm-hmm.
for us to start our own business, we both were in complete agreement. We are not doing that. So we went to private pay.
Mm-hmm.
And then with private pay, we were able to integrate other models because
Mm.
insurance doesn't pay for it.
Okay.
So we've always been, as part of our own holistic and naturalistic process with my thyroid cancer, I went to see a naturopathic doctor. That was the
Mm-hmm.
first thing I did. I had to pay out of
Mm-hmm.
pocket, which was tough, but you work it out, right? Like the
Right.
stars aligned.
Right.
So I knew that there was more to psychiatry than prescribing an antidepressant or an antipsychotic. Like I knew something was broken.
Mm-hmm.
So through schooling and through, just doing my own digging with the knowledge, evidence-based research and more education, I have 7 degrees. Like I love it. I love learning.
Mm-hmm.
I found the integrative psychiatry approach. And it
Mm-hmm.
really means that before we prescribe a psychiatric medication, I'm going to look at your whole body. That's
Mm-hmm.
metabolic. That's, nutritional support. They just might want to talk for the next hour.
Yeah.
Sometimes releasing that energy is
Mm-hmm.
more powerful to establishing a relationship for us to be able to make an informed decision on what to do next
Right.
versus the 15 minutes of, hey, how are things going? Yep, you're okay. Goodbye. Like,
Right. And
no.
schedule your next appointment so we can do it
Yeah.
again.
Yeah.
Yeah.
And, maybe the issue as a female is that your vitamin B12 is really low. Vitamin B12 is directly connected to your nervous system.
Mm-hmm.
Like, let me grab some labs and let's see, maybe this is nutrition, maybe you need a supplement. I'm telling you, if you're pregnant or you are a new mom, it's a lot better pill to swallow of a supplement, a vitamin B complex that you should be taking anyhow versus an antidepressant.
Mm-hmm.
You know what I mean? Where
Yes.
that's a tough pill to swallow when you're trying to protect your baby and yourself.
Mm-hmm. Mm-hmm.
So just, integrative really means looking at different approaches and just being open to understanding the root cause analysis.
Yeah. Oof. Getting to the root cause often does
Yeah.
not happen in
Yes.
the medical industry because not because people don't want to get to the root cause, but because the time constraints, the
Yeah.
insurance constraints, the model itself
Yep.
has so many red tape spaces that it
Mhm.
impacts, the entire process.
Yep. Let me give
All
you
right.
let me give you
Yes,
another example, Kristen.
please
Okay, you
do.
ready?
Please do. Yes.
So one of my girlfriends came to me and she's like,
Mhm.
Emily, you're a psych NP. I need to just pick your brain. This is what happens,
Mhm.
especially when you're a nurse, your entire family attack modes you
Sure.
because they're like, you're a nurse, you need to come advocate. It
Yes.
happens with your friends also. So this friend actually comes from a different culture. She's from a different country.
Mhm.
She immigrated here and she's just an amazing person,
Mhm. Mhm.
but her culture plays into some of what she was experiencing. So she's telling me how she feels, crazy and she's losing her hair and like all these physical and mental symptoms.
Mhm.
Well, and we talked before this and I never shared this with you, Kristen, but she actually had voodoo that was attached to her.
Oh,
So
wow.
her ex, very, similar other stories that I've heard
Yeah.
about, but her ex had been putting spells on her. And
Wow.
if you go to a Western medicine psychiatrist, they're going to
Mhm.
think that you're like schizophrenic
Absolutely.
or
Yeah.
you need to be on an antipsychotic.
Right.
No. So we were able to talk things out and I got her some support and she kept on digging for her own stuff and then shared with
Mhm.
me and I was able to add it to my referral basis. And through some really strategic mental health support that I was able to do with her, her
Mhm.
labs were off.
Mhm.
And with counseling, um,
Mhm.
and her own journey about learning more about voodoo that was part of her
Sure.
culture,
Sure.
she is doing amazing.
Oh,
Amazing.
that is
And
great to hear. Oh,
yeah, if she had gone to, someone, where where I'm
yes.
going, like Western
Yes.
medicine with
Yes.
insurance, oh my gosh, no way. No
Yes.
way. We spent
Yeah.
3 hours talking with one appointment. It was over dinner, but I, I was able to ask all these fabulous questions that never would have happened ever.
Absolutely. Yeah, people would have automatically dismissed it and brought out the DSM-4 and said, "Oh, okay, this
Mhm.
medication will help you here."
Yeah,
And that
it's
would
a
have been the end
band-aid.
of that. Yeah, that would
Yeah,
have been the
yeah,
end of that. And she still would not have solved the problem. And honestly, probably would have created more problems.
yep.
Yeah. All right. So you focus on helping patients build resilience and find balance. can you share some of the strategies and tools that can assist our listeners just in general? Of course, they should all consult with a doctor or,
Yeah.
whoever they need to on their end. But I always like to share some information with our listeners. So, what are some strategies that they can use that they can incorporate that are pretty simple for resilience and balance in their lives?
The one thing that I would just really want to encourage people to build resilience is to talk about their story. Because once you feel like you have shared, you
Mm-hmm.
understand that you're not alone. And
Mm-hmm.
with that comes the ability to feel resilient.
Ah,
You know, like, so, and which brings balance into your life.
mhm,
So
mhm,
if you are feeling, broken, or that people are just not listening to you, or you're just on this journey of really feeling uncertain, you begin to doubt yourself, and you begin to
mhm,
question, and you can become depressed, and maybe psychotic, like, who knows, like, you
mhm,
could spiral, down that road.
mhm,
but
mhm,
but I truly believe that most people just want to feel heard.
mm.
And when that sense of belonging, like in nursing school, we were taught Maslow's hierarchy of needs.
Yes.
When safety, when you feel that sense of
Mhm,
security, it
mhm.
helps you to become resilient because you know you have the chutzpah behind what you're saying.
Absolutely.
Does that make sense?
It makes complete sense. I have a degree in psychology, so I love some
Yes.
Maslow and Pavlov and all of them. Freud, I got down
Yes.
with all of them. But it was interesting to think about how, linking back to our earlier conversation, when COVID impacted us as a human experience, right? It became part
Mhm.
of this dynamic, how that core fundamental base, that foundation of safety disappeared. It was like a carpet was pulled
Yes.
out from all of us, children,
Mhm.
adults, everybody, because nobody knew what the heck was going on. And it's interesting because in biofield tuning, and I know we talked about tuning, we work with your energetic biofield that goes 6 feet out from your body. So it was fascinating when I look at, oh, during COVID, you couldn't go within 6 feet of each other, right? So now you're not
Ah.
interacting with each other's electric health or biofield. We
Mhm.
literally were disconnecting because we're all in my world, in my space, we're all electric, right? We're electric currents running. That's why we have EKGs and they stick the
Yes.
defibrillator on you because we do have an electric system in our body. But it was just so fascinating to see how they were like, nope, everybody stays 6 feet apart. So you're not touching people's
Horrible.
fields anymore at this point.
Yeah.
But just to think about how that whole foundational base of the hierarchy of needs was like literally stripped apart. It really messed with the psyche of so many.
When you talk to people who are at the front line, or, working in a hospital or whatever, the thing during COVID that, like healthcare workers, the
Sure.
thing that drove people the most nuts was not being able to touch their patients.
Yes. Yes.
So many people passed away
Mm.
with no one holding their hand.
Yeah.
That bothered them more. That exactly what you're talking about. And it's like
Hmm.
that electrical feeling that you're connecting your energies, your bodies, your mental health.
Hmm.
You're creating that empathetic um bubble that we couldn't
Yes.
do during
Yeah.
COVID. We
Yeah.
couldn't.
Yeah, my
Horrible.
brother passed away during COVID, and we were literally told we had to leave the
Oh,
hospital. And my mom
oh,
was like, "You go right
oh,
ahead and try to get me out of here." And it was insane because they set it up. It was like he was dying. We knew this. It wasn't like he was going to
yeah.
catch COVID at this point, right? And it was so hard to watch because being in, we were there for like 3 weeks, and just being in and out of that ICU and watching the nurses, they were doing everything they could, but then to be told, well, you could only have one person in at a time. And you
Oh,
have, yeah, it was insane. So, you feel for the
horrible.
doctors, you felt for the nurses, you feel for the families. You're
Mhm.
watching people pass away, and like, I mean, there was no funeral. You couldn't have funerals during COVID. It was absolutely insane. So yeah, it was just such a time
Horrible.
for sure. Yeah, absolutely. Okay, so you have a passion for working with nurses and caregivers. We know this because you are one. Those are your
Yes,
peeps. Yeah, so
I
how
know.
has working with this population contributed to your own personal mission in life? Like, I mean, it sounds
Yeah.
like this is your jam all the way.
Girlfriend, I feel like I am finally doing what my purpose is.
Mhm.
Um, so many of healthcare frontline workers, they really It okay, so when I worked at the bedside, one of our most favorite sayings to family members was, "If you don't take care of yourself, you can't take care of others." And that was really meant to tell family members, go home, take a nap, go take a shower, feel rejuvenated. Your loved one is here, your loved one's safe. I'm going to keep them alive until you come back,
Mm-hmm.
basically.
Yes, yes.
But us as providers, and I'm sure the same is for you, anyone who is providing this service of healing to
Mm-hmm.
somebody else, it takes so much out of
Takes a
you
toll.
as a
It does.
person
It
and
does.
your mental health and your physical health. So many of the frontline workers, healthcare workers, they don't ask for help because
Mm-hmm.
it's seen as a weakness.
Mm-hmm.
So, and then it's also connected to insurance because if you have a mental health diagnosis on your record, cops,
Mm-hmm.
military, um, ambulance workers, you can't get a job.
Mm-hmm.
So that's why we have tons of veterans coming back and living, couple months versus a couple like even Vietnam vets now,
Right.
like they're still living in the state of trauma, but they
Mm-hmm.
can't get help because they don't want it,
The
it is
stigma.
taboo. They don't
Mm-hmm.
want the stigma and they don't want it on the record.
Yeah.
So that is definitely a big push for me to try to help them, you know.
Mm.
And I really um I feel like it's my passion.
Mm-hmm. Oh,
My
and I
husband,
could
yeah.
feel it. It's definitely coming out for sure. It definitely is your calling. Yeah.
Oh, my other passion are those peripartum, perinatal mood disorders. I have twins. They're
Okay.
now 11, but
Wow.
I remember being, let's see, post delivery. So they were about 3 weeks old, and I chose to breastfeed. I still had to, pump and supplement, and I tried to do the best I can, and that's all. Every mom is trying to do the best they can, and
Sure.
judgment free, right?
Mm-hmm.
But I was breastfeeding both, sitting in my chair, rocking. I had zero sleep for about 3 weeks. And I remember like it was yesterday, thinking, I totally know why moms pack up their kids in their minivan and drive into the ocean.
Mm-hmm.
100%.
Mm-hmm.
Um, and I can laugh about it now,
Yeah.
but I was exhausted.
Mm-hmm.
So, all the people like trying to say to you, like my mom and our neighbor, let me go go take a nap, go take a shower. Nope, I can do this. My kids are
Mm-hmm.
dependent on me. I'm a super mom. I can do this. And I was working.
Yeah.
How you're crazy. You're
Mm-hmm.
crazy. My
Mm-hmm.
answer should have been yes. Let me go take a shower. You watch my kids.
Mm-hmm.
So yeah. Now I can do it just from a provider level, you know.
Mm. And sharing those stories and sharing how you're still a good mom if
Mhm.
you step away from the children. I
Mhm.
think there's this perception and this mindset, especially for women, where things have shifted so much, where there's these expectations, and a lot of times we put them on ourselves depending on what our limiting beliefs are in our life experiences of I've got to work, I've got to provide for the spouse and give all the love in the home and make sure the kids are taken care of, and there's got to be groceries in the fridge and make sure the
Yeah.
dogs and the cats and the fish and the gerbils and whatever else people have are taken care of, and we
Yeah.
feel like we have to do it all, and if we fall short of that we haven't
Mhm.
lived up to these expectations that we set that are unrealistic to begin with for ourselves, right? And yet
Yeah.
there's others that are just sitting there waiting for that
Yeah.
opportunity to help, to support. And
Yeah.
there's this resistance to accept that support because it could be perceived as a weakness when it's really
Yeah.
not,
Yes.
you know.
I had one client who came in, she was exhausted, a new mom. My prescription for her was a nap.
Hmm.
Go take a nap.
I love it.
Just conversation.
Yes.
She felt better, but no, the answer is not putting somebody on an like an antidepressant. No, no.
Hmm.
Like yes, that might be important at
Mhm.
some point, but for this person, no. And
Yeah.
we had the time to talk that through, you know,
Mhm.
and just
Mhm.
kind of navigated it and saw where it went,
Yeah.
you know.
And it's important because you took that time to have the tough conversations to really dig in and find out like, okay, what is your sleep schedule? What is your nutrition schedule? What is your work schedule? When you can understand a person's lifestyle and you can understand the parameters in which their world operates, not your world, not what society says world should be, not the parameters of what, Susie Q next door is doing, but what does your life look like? And then let's work within the constraints of your life. Sometimes it's
Yeah.
literally just a lifestyle modification to get back to the balance that you're
Yes.
talking about. It could be very
Yes.
simple, like go to bed an
Yes.
hour early, or I don't know,
Stay
take the
off
cell
your cell
phone.
phone.
Yes, yes, take the cell phone away from the
Blue
side of
light.
your bed because you're going to want to look at
Yes.
it. Like, no, get off the social media.
And you can probably school all the rest of us. Having your cell phone next to your head while you're sleeping gives off energy
Horrible.
waves
It
that
does. It's
impairs
horrible.
your REM sleeping.
The
Step
EMF
away from the phone.
frequencies, yes, the EMF
Yes.
frequencies are horrible. Having your internet box in the same room that you sleep. I actually on the back of my cell phones, I don't know if we can see it. I always put
Yeah.
these, it's shungite. It blocks EMF
Oh,
frequencies, and I put that on the back of my phones. Doesn't mean that it's foolproof. The other thing that
yep.
gets me is everybody wants to wear Aura rings. Nothing against
Yeah.
Aura. They don't sponsor me. I don't have any ill will against them, but people are using these devices on their bodies to measure
I
things. They're
know.
all sending electromagnetic frequencies. So it
Hmm.
stresses me out because I know people want to know, is their pulse good? Or did they get enough sleep? How
Hmm.
about you just disconnect from all of that? Because it's
Hmm.
dysregulating your
Hmm.
biofield. So it does, it
Yep.
stresses me out.
We
And I
digressed to a
know as a
different
health and
topic.
wellness coach, yeah, health and wellness coach, they get upset with me because they're like, I'm like, hey, I'm a health and wellness coach too, but I'm just telling you, if you really consider the disruptions we're putting in our body, looking at that cell phone before bed, you're getting all your brain waves activated and stimulated,
Yes.
just like as if you just ate a bowl of sugar or something, because
Hmm.
you're seeing something, your body's responding to it. Then there's the blue light
Hmm.
versus the non-blue light. So much. We could go on for hours. That could be a whole conversation. Ugh. I can't believe it, but we are coming up on a full hour of conversation. I only
Wow.
got through half of what we were going to talk about today. But before
It's
we wrap
okay.
up, yeah, before we wrap up, I do want you to share, if you could just share one message with our listeners, what would it be? And then I want you to let our
Okay.
listeners know how they can get in touch with you if they'd like to schedule an appointment, learn more about your services, just connect. So, both
Uh-huh.
things. What's your one message to the world? No
Okay,
pressure.
my message. Yeah. I'm gonna take it from Michael Jackson and
Okay.
his song You Are Not Alone. You are not alone. Do you know that song that Michael
I do.
Jackson
I
said? I
do.
can
I
just
thought you were going to
totally
start
picture.
singing. Yeah, I thought
I
you were going to
know.
start singing. I was ready
I
for
could
it. I
do
was
that
like,
too.
yeah, I was like, do I do the
You are
harmony?
not
Like,
alone.
I am here
No,
with
I know.
you.
I am here with you.
That's
No,
right.
you're not alone. Mental illness, mental health is very isolating. So just reach out, you just need to form your bubble of support. And sometimes that could be through a practitioner.
Mm,
Um, it could be people like me prescribing, whatever, but you need to have your bubble. Um, I am, in the state of Massachusetts. So as far as my practitioner license, I can only accept clients to prescribe in the state of Massachusetts. But the easiest way to get in contact with me is Dual Minds Integrative Psychiatry is the name of my business, www.dualmindspsychiatry, because adding the integrative was too long, according to my brother.
oh my gosh.
So dualmindspsychiatry.com.
I love
You
it.
can also, yeah, crazy.
Thanks,
Um,
brother.
we're yeah, we're quote unquote normal people, right?
Yes, there you go. I
No,
love it. Yeah.
I
Well,
know.
they could have spelled integrative wrong and then they go to the wrong
I know.
website and people, yeah, I
Mm-hmm.
understand.
Mm-hmm.
Totally understand.
Yep. And then my work phone is 508-233-8354. But I'm here for, anyone, even if you have a question and you just want to email or I will do my best to support you. you know.
Wonderful. I appreciate that. And the other thing I want to point out too, and I know you know this for sure, and you would foot stomp the heck out of this. It may not be that you have this lifelong mental health battle going on, right? We have situations that arise. You could be going through life and everything's perfectly great, and you're living your best life, and you're camera ready all the time, and things are wonderful. And then different things happen, life happens, you could lose a job, or you could have a death in the family, or I don't know, maybe something from childhood comes up out of left field that you didn't know about, and it could be a very specific thing for only a certain time period in your life. It doesn't mean that seeking support means you have to have this diagnosis and this condition and this
Yeah,
battle, and it's all a struggle. It could just be situational. It could just be something came up, you need somebody to talk to help get through a rough time, right? So
absolutely. That's the good thing too, I know we've kind of gone back to it as being private pay. So
mhm.
with insurance, you have to document those kind of things, and if
Right.
you're not on as a psychiatric mental health nurse practitioner, if you are not on a psychiatric medication, I
Mhm.
cannot continue to see you. As
Yeah.
private pay, um, I don't fall under that window anymore.
Mhm.
So I can have clients that I'm helping and it's a check-in and
Mhm.
they're not on a med, any psychiatric med for the last 2 years, but they just need that integrative psychiatric approach. So like I might be reviewing their supplements, I might be talking about goal setting. I might be, weight loss management and it's connected to their have a new job and they're totally
Mhm.
stressed out and 6 months later they gain 30 pounds. Like that's mental health related. So
Mhm.
um it really provides me the opportunity to provide better support for my clients.
Mm.
So it's
Good
exciting to
stuff.
be in this bubble. It,
Yes,
it's
and I'm
it's
excited.
definitely different. It's
And
different
I'm excited
than
to have connected
yeah.
because I know there are so many people out there listening today that, could benefit from your support and your services. So we'll make sure that information for listeners, it'll be on the information on the webpage, both for social media posting as well as on the radio page, so that you can get in contact with Dr. Emily. And thank you for coming on the show today. This has been an absolute pleasure. We're going to definitely have you back on. There's so much more we can talk about.
I'm
So
happy to, support you in any way because you're an amazing
wonderful.
person and you deserve the
Oh,
best, girlfriend.
thank
Mhm.
you. You as well, my friend. You as well. So, for our listeners, thank you so much for taking the time to listen to this episode of the Surviving the Human Experience podcast. And until next time, be well and stay blessed.